Hello, welcome to the Stress and Distress webinar series. This series has been developed by the Department of Clinical Psychology, Older Adult Mental Health Service in NHS Grampian. This module is the Iceberg Model. You may have heard the saying, it's just the tip of the iceberg. This is a principal idea of the Iceberg Model, which suggests that what we see is only a small amount of what is going on for any individual. We can see from the image on the screen, the tip of the iceberg is very small compared to what might be unseen beneath the surface. Let's familiarise ourselves with the iceberg model in more detail. This is how the iceberg model is often presented. We can see here a clear line that defines what lies above and below the surface. This defines what we immediately see versus what we don't. Some things that we may be able to observe or view above the surface are behaviours and the environment. However, we know that these are not the only factors that contribute to how we feel and why we may behave the way that we do. Some factors that lie below the surface, or factors that we don't immediately see, are mental health, physical health, personality, lived experiences such as trauma, cognition, beliefs, these may be about ourselves, the world and the future, medication and side effects, perceptual deficits such as poor eyesight or hearing, or loss or bereavement. Hopefully you will recall the biopsychosocial model, which we covered in a previous webinar. We can also imagine that this model would sit below the surface in our iceberg. Hopefully now you will have a better understanding of the iceberg model, but you may be wondering how it applies to dementia care. When we think about someone's experience of distress and dementia, we need to think about the underlying causes as well as the outward signs. The distress behaviour is just the tip of the iceberg. A large part of the iceberg is under the water and represents what we don't immediately see or maybe think about. The model therefore allows us to consider these aspects in some detail. The iceberg model also allows us to gain a better understanding of the causes and contributing factors for the distress behaviours we observe. This then allows us to develop person-centred, proactive and preventative strategies to reduce stress and distress. Let's look at a case example in the next few slides to demonstrate these points. This is an image of Robert. He is a 78-year-old gentleman and he's living with Alzheimer's disease. Robert lives in a local care home. He moved into the home approximately 6 months ago and has been quite unsettled since moving. Most mornings, Robert wakes up early and attempts to leave the care home. He finds the doors are locked and he will often then bang on the door or kick the doors, and he will be found shouting, saying, "I need to leave, why won't you let me leave?" Robert is visibly agitated and upset. It's difficult for staff to distract Robert or move him away from the doors. When Robert is able to move on, he will often be seen pacing the corridor, keeping an eye on the doors, and staff have also observed him wringing his hands. This iceberg demonstrates what may be going on for Robert. We can consider the behaviours that we see above the surface and also the contributing factors that lie beneath. This iceberg model reminds us not to just focus on and label a behaviour, so the thing that we can see, but to instead think about what might be going on for the person and the underlying causes that lead to these behaviours we observe. So what we do see above the surface might include Robert's care environment and also his interactions with other people. So sometimes we do see Robert interacting really well with staff and other residents, but there are other times when he becomes distressed. We see Robert shouting at care staff. We also see him banging on doors, pacing the corridor, and quite often wringing his hands. So to make sense of these behaviours, we can consider what may be going on below the surface. So let's start at the bottom of the iceberg and work our way up to the top. So let's consider Robert's cognitive and neurological status. We know that Robert's living with Alzheimer's disease, so this has therefore caused some memory problems. He may also be experiencing a timeline shift, where he believes he is a different age. Robert may also experience confusion and also display repetitive actions, such as repeating himself or asking the same questions. We can also consider metabolic changes. Is Robert hungry? Is he constipated? These things may be affecting his appetite, his energy levels, and also his irritability levels. We can also think about Robert's physical difficulties. We know from his medical records that Robert developed arthritis in his 60s, and we can see that it's gradually become worse. This therefore means that Robert's quite often living in pain. We can see that his hands are sore regularly as well. Robert has also gone on to develop a tremor, so this means he will often drop things. And we know from observations and supporting Robert to get ready in a morning that sometimes it can be quite difficult for him to get dressed and to get organised for his day, as he's often repeatedly dropping objects or can find it difficult to pull his clothes on. I don't know about people listening to this webinar, but I think I would start my day feeling quite irritable if I was constantly dropping things or finding it difficult to get dressed and to get started with my day. So I can only imagine that Robert would be feeling the same way. We can also consider Robert's pre-morbid personality. So this is us thinking about what was Robert like before he moved into care and before he was diagnosed with dementia. Robert's family have told us that he's always been a shy person with a strong work ethic. They've specifically told us that he would be incredibly embarrassed and agitated if he thought he would be late for work. It's also helpful for us to think about any perceptual deficits. So by working closely with Robert for quite a while now, we know that Robert needs glasses and he also requires hearing aid. And he also has some false teeth. So it's obviously important for us to ensure that these things are clean, they're the correct prescription. And it's also helpful to make sure that Robert has picked up his own glasses and not actually accidentally picked up and popped on someone else's. We can also consider Robert's mental health. So we know that pre-morbidly, Robert was a shy person. In addition to this, his family have described him as being a bit of a worrier. We've also noticed that since Robert moved into care, his mood can dip sometimes. He can appear quite low and quite tearful and anxious. Due to Robert's physical health conditions, he also receives quite a lot of different medications, and unfortunately Robert can suffer from medication side effects. These include feeling sick, a loss of appetite, and occasionally Robert will complain of headaches. So the final thing for us to consider in our iceberg is arguably one of the most important things to help us make sense of a behaviour. We want to think about a person's beliefs. What do they believe? What do they think is going on for them right now in this present moment? So from observing Robert and from looking at his getting to know me documents and from speaking with his friends and family, and actually also just asking Robert how old he is, what year it is, we've actually been able to understand that Robert has experienced a time shift due to his Alzheimer's disease, and he now actually believes that he's 20 years old. We know from all of our information gathering that when Robert was 28 years old, he used to work in a yard from 6 till 2 p.m. We can make sense here that this is potentially why Robert appears so agitated in a morning at around 5:30 to 6 a.m, as he believes he needs to get himself to work. If Robert didn't get to work, his pay would be docked. He wouldn't be able to afford to provide for his family for that week if he didn't arrive to work on time. So again, I think it would make perfect sense for him to be quite agitated and quite upset. So Robert, believing that he's 28 years old, working the early shift, this very much links to his need to get up early, to leave the ward, and to get to work. He's therefore then anxious about being late when he discovers the doors are locked. Robert was always a dedicated worker, and work was really, really important to him. We can therefore use all of this information that we know, this information that we've gathered, to respond to Robert in a much more person-centered, proactive manner to attempt to reduce his distress. Please take a moment to pause the video and consider, based on the information we now know about Robert after looking at the Iceberg model, which strategies you might use to reduce his distress. Pause the video here, consider the strategies you might wish to use, and then play the video once you've written them down. Some strategies we might suggest are validation, so stating, "I can see that you're anxious right now, Robert. I'm sorry you're feeling this way." We may also wish to use distraction, however ensuring that this is meaningful and something that Robert will enjoy. So distraction for Robert may include mechanical work, asking him to tell us about it. We may also encourage meaningful activity, so would it be possible for Robert to work with the care home handyman early in the morning as if he would be getting up to go to work? The NHS Grampian Stress and Distress Core Group have developed this Iceberg Model poster to serve as a reminder to consider the model during your day-to-day practice when managing distress and dementia. If you would be interested in receiving copies of the poster to display in your care home or ward setting, then please get in contact with your local stress and distress practitioner or community mental health nurse. If you require additional support in managing stress and distress, please contact your GP or community mental health team for further information. Thank you for listening. You've now completed the Iceberg model. Please move on to the next video